Hello, everyone. Am I audible to all of you? Am I audible?
Yes.
Thank you so much. Let's start our today's webinar. I welcome you all in this webinar, and the topic of today's webinar is strategizing your OET preparation and a guide for effective OET planning. So before starting, I would like to introduce myself. I'm Dr. Maryam Zulfiqar, OET mentor at MedExam Expert. So let's start today's webinar. And because the topic of webinar is very good today, so I am hopeful that I would be the person who would be clearing all your doubts and the other ambiguities regarding this exam. So let's start with the very basic thing, like what is OET? And I must know that you all must be knowing about this thing as well. So OET is Occupational English Test, and OET accurately reflects a candidate's ability to communicate in an English-speaking healthcare workplace. So that's why this exam is needed. I'm just going through the basic overview of this exam for those aspirants who are new to this, who don't know about what this exam stands for and what is the purpose of this exam. So OET reports a scale score from 0 to 500, which means if we have equivalent in grades, it means from A to E for each individual subtest. So if we talk about subtest, so you might be knowing about this, but if you are not knowing about this, let me tell you that there are 4 subtests, which includes listening, reading, writing, and speaking. So you will be evaluated for all of these subtests separately. If you are good to go, if you are scoring 450 to 500, then definitely you can ace this module and you can achieve your desired grade and you can apply for your desired destination. So OET exam is accepted by healthcare professionals who are looking for or study in healthcare sectors in, I'm just going to name few countries so that it may give you a clear idea that which countries are accepting this exam. So it is accepted by Australia, Canada, Ireland, Maldives, Malta, New Zealand, Philippines, Qatar, Singapore, Spain, Ukraine, United Kingdom, United Arab Emirates, and United States of America. So these are the countries in which if you are taking OET exam, then definitely you can apply for their medical council or the medical regulatory body, whatever the thing is. So now it is a very basic question, like what is the eligibility criteria for this exam? Because the thing is, those students who are who just have passed their final year exams and they are looking for a house job and they are thinking that, because we know that unfortunately our own country's situation is not good regarding health sector. So it means that most of the new medical students who just passed out are trying for their future abroad. So but the thing is, they are not exactly knowing what is this exam for and how they can give this exam and what is the eligibility criteria and what is the validity of this exam and what is the accurate time that on which they can book their exam or they can appear in the exam. So it is conducted by Cambridge Boxhill Language Assessment, Occupational English Test, or more commonly referred to as OET. Is an exclusive English test that has been designed for healthcare professionals. The OET exam has been specifically designed for 12 healthcare professionals, including occupational therapy, dentistry, nursing, radiography, veterinary science, medicine, speech pathology, physiotherapy, dietetics, and pharmacy and optometry. So these are 12 professions. 12 healthcare professions can take this exam for who are planning for settling abroad and who are planning to pursue their career in abroad. So these are some of the professions which I just named in front of you. So time span of preparation, it is another frequently asked question by a lot of aspirants, and I would suggest all of them that ideally 30 to 45 days are required to prepare for this exam. If you are good enough in English, I would say that 30 to 45 days are more than enough for this exam, because this is not exam of your clinical skills. It is exam of your language. So definitely if you are good in speaking and writing and understanding English, then definitely you are good to go to prepare this exam in just a 1.5 months. You need to practice at least 30 listening tests, 30 reading tests, 15 letters, and 10 speaking modules if your basic English is good. If your basic English is good, then this formula applies, like you can take this much amount of test for doing best in your real exam. If basic English is not good, then you should have 60 days maximum for taking the exam, like around 2 months. I'm saying this for those students, some of the time scenario is different. Like some of the students are doing job as well, and with the job, it is a bit difficult to prepare and taking time for the studies as well. So I think so 2 months are enough if you are doing job. But if you are not doing job, and then I would say 1 month is more than enough to prepare for this exam. Another question arises is when to book. So I think this is the most, I would say this is the most intelligent question by a lot of students who ask me, like, when to book this exam. With increasing ratio of healthcare professionals applying for foreign jobs and study, ideal situation is to get your seat booked 2 to 3 months earlier before sitting in it, because situation these days is awful, and sometimes you may face difficulty to secure your desired city, if you are living in Karachi, if you are living in Lahore, definitely it would, your desire must be to book your slot in your own city. So if you are not going to do this, then definitely you may have hurdle of booking the exam in your own city. So the thing is, if you are planning to take your exam in coming September 2024 or October 2024, then I would say it is the ideal time in this month or in the next month to book your slot. Another question student ask around cost of exam. So nothing has been changed, because a few days ago I was having a query regarding the exam cost, and its students were asking, like, we have heard that exam cost has been increased. So the exam cost it has been conducted by Australia, so it is 587 Australian dollars, which is equivalent to 1,50,000 PKR. So the thing is, because we don't know about the rate of the Australian dollar, so we have to make amount equivalent to it. It is not the like amount in PKR. So that's why students get confused and they think that OET exam is like a cost of exam is getting increasing every day. So the thing is, it is static 587 Australian dollar, but when we get equivalent, then definitely it is increased in other currencies. Exam is conducted 24 times a year, which means it is conducted twice a month. So after every 14 days, it is conducted in those countries which I mentioned earlier. So it is advisable, whatever your slot is, like in which country, in which city you are planning to book, it's up to you. But the ideal situation is, please make sure that you must be having a slot there. Now, I'm going to talk about some of the things regarding scoring criteria, because this is the basic thing regarding this exam. A lot of students don't know, like, how you are scored for all the 4 modules in OET exam. So I have told you that there are 4 modules for like assessing your English skills, and these are listening, reading, writing, and speaking. So your first module is listening module, and you will be having time allocation of 45 minutes for this module, and the total marks are 42. Use the calculator to find out how many correct answers you would need to get a B grade in reading and listening module. This is the key point, because the thing is, comparatively, part A and part C, like part A in both listening and reading, and part C in both listening and reading. Part A is comparatively easier than part C in both listening and reading. So I would say to all the aspirants, put your maximum effort on part A and part B, because part C is very much difficult. So I think it is sane idea to say anybody, like if you are getting all correct in part A and part B, then definitely you are having margin to do mistakes in part C. As per the OET websites, one typically needs 30 marks from 42 questions to get a B grade. So you have to score 30 out of 42. So you have margin of 12 questions wrong. So I would say you should complete, you should score 30 out of 30 in part A and B, because part A consists of 24 questions and part B consists of 6 questions. So it is better to score and to do all them corrected, so that you would be having margin for mistakes in part C. The OET listening papers are marked by combination of assessors and computers, because your part A are being assessed by the assessors, like the physical examiners, and your part B and part C would be assessed by computer. For part A, which is the task that requires the test taker to fill in set of notes about a consultation between a doctor and a patient, assessor marks the answer. And other parts of OET listening, part B, C, are computer scanned, as they are multiple choice tasks. Part B includes 6 short conversation or monologues that include different healthcare professionals such as nurses, doctors, OTs, or ward leaders. And part C features 2 longer presentation or interviews on journal healthcare topics. So this is overview regarding listening exam. And I have told you that you should try your maximum effort on part A and part B. Then definitely you would be able to score maximum in listening module. So there are some of the journal tricks for scoring 30 out of 42. Try to correct all 24 in part A and all 6 in part B, which is not a difficult task to do. Let me reassure you, if you are going to do this, definitely your listening module is the past one. And how you can do this, I told you that you have to practice at least 30 tests before your real exam. If you are doing this, if you are following my advice, then definitely your listening module, in your listening module, you can achieve your desired grade. You will be having margin of doing mistakes in part C, which actually is difficult and challenging. So no doubt, I know that, I truly know that, because aspirants tell me that part C is very difficult, and I agree with them. It is the most difficult and the most challenging. So if you think that you are unable to do part C, then definitely you must do part A and part B all correct. For this, try at least 30 to 35 tests for practice before real exam. Then your score is in OET listening will reach 30 plus in the real exam. So there is a total of 42 marks available in reading subtest. Now I'm talking about reading module. Part A accounts for 20 marks. Part B accounts for 6 marks, and part C accounts for 16 marks. So this is the marks distribution in reading module. Here are 5 ways to read faster and tips for approaching OET reading part A. Again, my rule is the same. Like if you have to score 30 out of 42 because it is a B grade, so definitely you have to correct all questions in A and B as well. So begin with skimming. So the thing is, skimming is just you have a bird eye view of the passage. You don't go through each and every depth of line. Highlighting keywords. So it is the better idea to highlight your keywords which has been asked in the reading module, so that it would be easy for you to find your answer, because 80% of the time your answer is around the keyword which is mentioned in the paragraph, in the passage. Okay, so some of the times, I would say 80%, 85% of the time, it is around that keyword. Retain exactly what you read. Be prepared to read a question. Skip the options. Provide yourself with plenty of practice. Again, the same formula applies that you have to practice at least 30 to 35 tests before appearing in the real exam. Try to correct all 20 in part A and all 6 in part B, which is not a difficult task to do. You will having margin of doing mistakes in part C, which actually is difficult and challenging. For this, at least try 30 to 35. And if you think that because after solving 4 or 5 tests, you will be having confidence that you are doing very good in the reading module, but still, if you are not having confidence, then after some more tests, you will be having confidence. So this is very important regarding confidence building of a candidate. So I would say that it is very much significant for you to try this number of tests for reaching your desired grade in the real exam. So now we have discussed about listening and reading, and now OET writing is the third module in OET exam, and we will be talking about the scoring criteria for the OET letter writing. So first of all, I would tell you that you have only to write one letter in the exam, because there is a confusion in every student's mind that they think that because there are number of letters like discharge letter, transfer letter, referral letter, so students think that we may be writing 2 or 3 letters in the exam. So no, you are only allowed to write one letter, and there would be no choice. It's totally up to your luck. It's totally like we would say it's totally up to your fate, like which letter you get in the real exam. It can be referral, it can be discharge, it can be transfer. So make sure you are prepared for all the type of letters. How many points you need to score grade B in OET writing? So total marks you can get is 38 points. I'm just talking about writing module. I would say this is the beneficial information for our course student as well, because I am the writing mentor in our regular course, and a lot of students want to know about the writing assessment criteria. So please listen carefully. You need to score the following for grade B. I tell my students that your purpose must be excellent for achieving grade B. So the purpose is having 3 marks in letter writing. And if you are scoring 2 out of 3, you are in good hand and you can achieve grade B easily. If your letter is like the rest of the letter is satisfactory and there are some of the minor mistakes which can be neglected. But condition is your purpose must be very good. So for content, there are 7 marks. If you are having 5, then definitely you are good. For the clarity, again 7, and you have to score 5. And for the genuine style, it's again 7. You have to score 5. And organization and layout, which means sequencing of paragraphs, it's again 7, and you have to score 5. And for the language, I tell my students that language must be clear and simple. In OET exam, examiners don't like fancy English, so you have to be very clear and concise. So again, it containing 7 marks and you have to score 5. So total 27 out of 38. And it means it is grade B, which is 350. Because most of the professions in OET exam, it is 350. But I think for the nursing, OET nursing, in the writing, it is C plus. It is not B, it is C plus. But the rest of the module is grade B. So for every professions, you have to check on the OET official website, like for your profession, what they are demanding. So I'm telling about nursing and the medicine. For the medicine, you have to score 350 in all. And for the nursing, it is 300 in writing and 350 in all. So writing assessment criteria, the purpose, I told you that purpose must be excellent. So the purpose should be easily and immediately identifiable for the reader. So there is no search for it, because some of the times students think that we have to start with the symptomatic history of the patient, and they easily forget to write about the purpose of the letter. But some of the time student is not being prepared for writing exam, and they don't think that in letter writing there could be a purpose as well. So this is the big blunder. If you are going to do this, examiners don't bother to read rest of your letter. So please don't do this mistake. Next, the content, the key information is included. No important details should be missing. And for the clarity, no relevant information included. Information is summarized effectively and presented clearly. So these are the points. These would be helpful for you while you are writing a letter. For the genuine style, appropriateness of your letter based on your reader, your registrar, and tone should be professional and appropriate to document's purpose and audience. So for next is organization and layout. Key information is highlighted and subsections are well organized such that reader can retrieve information quickly and easily. And for the language, spelling, punctuation, vocabulary, grammar, sentence structure are accurate and do not interfere with meaning. So now we have discussed 3 modules for the OET exam, which were listening, reading, and writing. So for listening, you would be having 40 to 45 minutes. For reading, you will be having 1 hour, which is 60 minutes. For writing, you must be having 45 minutes. And now there comes speaking, and you will be given 20 minutes for speaking. What happens in OET speaking? You have to complete 2 role plays with an interlocutor. You play the role of your profession. For example, nurse, doctor, physio, whoever you are, whatever your profession is, you have to play that role. And the interlocutor plays the role of your patient or their carer. You are given all the information you need or a role play card, and you have 3 minutes per role play to prepare. You will be advised that you are having 3 minutes, and after that 3 minutes, buzzer will ring and you have to start your role play. Not only is this a more comfortable scenario for you as a healthcare worker, but it also means that you are preparing for your test, you are improving the language and clinical skills for your future workplace. So this is not just for testing you. You have to be very fluent and you have to be very good in English when you arrive your desired destination, because definitely in those English speaking countries, you have to talk to your patient or the carer in English. So please be prepared for that. How are you scored in OET speaking? So now we will talking about speaking scoring criteria. Your role plays are recorded and assessed by at least 2 trained OET assessors. They rate your speaking performance using linguistic and clinical communication criteria. So in this blog, we'll outline each criterion so you can see at a glance how your speaking skills are measured. So now you must be knowing that your OET speaking would be assessed upon 2 aspects, like linguistics and other is clinical. So for the linguistic criteria, they have to see some of the factors which are intelligibility, fluency, appropriateness of language, and resource of grammar and expression. So intelligibility, this means you being able to speak clearly so others can understand you. You need to pronounce words and sounds clearly. Use the right tone of voice and use stress and rhythm in your sentences. So for the fluency, this means speaking smoothly and at right speed. You should not speak too fast or too slow, or you should not pause too much or hesitate when you speak. For the OET speaking, when this is the important point, like this, hesitate when you speak. Whenever aspirant is so much hesitant to talk and there are the buzzwords like it gives a very negative impression. So please be calm, be very confident, and you have to talk in fluency. Appropriateness of language, you have to use the right words and the tone for the situation of the patient. Like if the patient is dying and you are going to tell him that he is having cancer or he is having any of the other serious disease, then definitely your tone must be very soft, and there must be empathy in your language. So if you are going to say so that like in a very normal way, then definitely you will be losing your marks. So they will be assessing you upon your style of like conveying your messages and your tone as well. So I think you should be very particular about all these factors as well. So resources of grammars and expression, this means using a wide range of vocabulary and grammar correctly. If you are good enough in vocabulary, I would say in speaking it impacts much, and you should use good words for vocabulary, but make sure that you are using correct words. You should be able to express your ideas clearly and without any confusion. So now these were about linguistic criteria. Now we are discussing about clinical communication. Clinical communication. In clinical communication, the first factor is relationship building. Most of the times in healthcare setting, patient is not interested in talking to a doctor. So in that way, you should make him comfortable, make him or her comfortable that you are the one who is going to provide him or her a care. So in that way, you must have to build some kind of trust between you and your patient. In this way, your relationship will be built between you and your patient. So examiners are going to assess this thing as well, like how good are you like in building your relationship with your patient. So this means starting the conversation in a friendly and respectful way, listening carefully to the patient, not judging the patient, and showing understanding for their feelings and situation. And one thing more, because aspirants do a lot of mistakes here, that they are in a rush of completing their bullet points for the role play, and they are not going to listen to the patient. Like if patient is saying something, they just overpass them and they are going to finish their scenario. So it is a complete blunder. You have to listen to the patient even your time is running out. Still, you may be able to get grade B, but if you are not listening to your patient and you are overpassing them, you are not paying heed like what your patient is saying, and you are just in a rush to complete your sentences, your bullet points, definitely you are not going to get grade B, because you are not showing respect to your patient. So now understanding and incorporating the patient's perspective, this involves asking about and understanding the patient thoughts, worries, and expectations. Some of the times we advise students that after finishing every bullet point, you have to say, am I understandable to you? Am I clear to you? This is for this purpose, which is I'm telling you, like understanding and incorporating the patient's perspective. So it may assure you that your patient is understanding whatever you are saying. And definitely this will give examiner a sense that this person is capable of conveying her message to the patient in a formal way. So providing structure, this means organizing the conversation in a logical way, clearly indicating when you change the topic and use techniques to make your explanations clear and organized. Please make sure that whatever you are saying to your patient, it should be clear, it should be understandable by your patient. Information gathering, it means listening carefully to the patient's story. I told you earlier that you have to be very careful for whatever the patient is saying. It means you are gathering information from your patient. And then the other thing, other factor which is also included in clinical skill is information giving. It means like what kind of information you are giving to your patient about the treatment and the management. So these are the factors upon which you are being assessed in speaking module. So we have discussed about all the modules, scores, and the scoring criteria. And now, if you guys have any question, please ask me, so that then I will be proceeding for the course details, which we are going to start on 15th of May. So if you guys have any question, please ask me, so that after that, I will introduce our course features. Thank you.
Yes, ma'am. I want to ask that. Hello.
Hello, I can hear you.
Ma'am, I want to ask the question that somebody said that for the PLAB, you need the equivalency certificate from OET to IELTS. Is it true?
From OET to IELTS?
Yes.
Can you please be clear in your question? You are talking about two exams, I guess.
Yes, I know I am talking about the two exams, but in
Mm-hmm.
some group, somebody said for the GMC registration, IELTS is
Mm-hmm.
needed, not OET. OET is not in the option. So we need for the PLAB OET
No,
equivalency
it is
certificate
it
for
is it
IELTS.
is not it is not correct. You can book your PLAB even with OET as well.
Okay. Another question is, ma'am, if, for example, in one module, I will get the 340 or 320 marks. So all the exams should be given again, or can I give one module in which I got the less marks?
No, you will be having like all the modules to appear. You have to book your exam again.
And there is any benefit about scrutiny? Of scrutiny, somebody said that we do the scrutiny for writing and we do the scrutiny for reading. Is there any benefit of it?
You are asking about some professionals, or I don't know, like you are asking about.
I'm asking about the OET, for example, in one module, if the student get 320 or 340, in the
Mm-hmm.
group, somebody said that scrutiny for the writing, it's will
No,
beneficial
no,
or not?
no. Complete no. It is not beneficial.
Okay, thank you, ma'am.
You're welcome.
Assalamualaikum, ma'am. How can we
Walaikum
improve
assalam.
our How can we improve our listening? Because
For
I am
listening,
getting problem.
okay.
Yes.
So I told you earlier that you should be practicing 30 to 35 tests, but it depends like which material you are using. So I would advise you to use authentic material because there are number of material now on the internet. So it is the first thing. Like you have to just use the material which is exactly similar to the exam pattern. So next thing is the other things which can make us good in listening module. You can listen to medical podcast in different accents on the YouTube. It will help you in understanding different accents because some of the times in listening module accents are 3 or 4 accents are there, so you would be able to understand like what the person is saying. So it is just for your practice. You can do this, you can try this, and then you can solve any of the tests, and then you can see this like how you are improving in this.
Thank you, ma'am.
You're welcome. Any other question? If you have no more question, then I think it is the better time to introduce our course. We are going to launch our course, OET regular course, on 15th of May. And if you want to book yourself and enroll yourself, you can do it now. You will be having 16 live practice session for all the 4 modules. So for every module, there will be 4 sessions in every week. So like one for reading, one for listening, one for writing, and one for speaking. So we have to cover our course in 4 weeks time. So you would be will be providing with the course content, practice exercising for all the 4 modules, and the live letter assessment. Because I am a writing mentor, so I can tell you better about writing. That in writing sessions, just after the sessions are over, I would be going for live assessments of the letter I assigned to the students, and then in the next session we would be having live assessments of all the students. So it is a better idea of growing together, because the thing is everybody of you will be learning about mistakes. So speaking practice with individualized feedback, and you will be given the whole feedback, like what were you lacking, why you were not saying this, and what is your grade. So study room guidance, session recordings as well, if by any chance, because I know that most of the aspirants are working as well, so they could not manage with the like their duty timing. So the good thing about this course is that you will be providing with the recordings as well. And mock exam for final evaluation, this is the best thing in this course, that you will be having a chance to get evaluated for your exam before appearing in the real exam, and access on website for later revision. You will be having access to med exam website, 24/7 technical support, and easy to follow schedule. So still, if you have any question regarding our course and regarding any other thing, you can ask me.
Ma'am, how many hours should we study if we are planning to give the OET after 1 month?
It totally varies. I would say, like, every day you should be having one listening, one reading, and letter writing should be done every 3 days, and speaking should be done like in 2 to 3 days. So this is the pattern you must follow for preparing in 1 month.
Okay, ma'am. Thank you.
You're welcome. Any other question?
Thank you, ma'am, for this valuable session. You are so kind. Thank you so much.
You're welcome. If there is anything in the comment box, there is a query: which exam should be preferred, either online or offline? Written form. It's totally up to you. Like, if you are from the beginning, like you're class 1, if you are confident for offline exam, I would say go for it. But if you are like me, like you have to prefer exam on paper, then definitely you have to go for it. It's totally up to candidates' own choice. Okay, I think Faizan has shared group link as well. There is a group free group activities conducted on Monday to Friday. So I think, Faizan, it's better idea to share the link of the group as well with the candidates, so that they can be a part of uh, the group activities as well. So I think there are no more questions. And thank you so much for your presence in today's webinar. And good luck for your exam. Allah Hafiz.
Allah Hafiz. Thank you, ma'am.